Hi, I'm Linda Gordon, and I'm with Linda Gordon Insurance Solutions. I'm a Medicare specialist and an independent broker. I was with the Department of Aging in New York since 2014, where I gained all my knowledge and expertise of Medicare, and I'm bringing that knowledge and expertise to help you with your Medicare decisions. Many times I'll meet somebody and they're turning 65 in a few months. Some of them have waited to the last minute, and I'm going to try to help them get this all put together really fast so that they don't miss out on their Medicare starting in a timely fashion. So what I find out is when you're going to turn 65, if you're eligible if you got Medicare, if you're eligible for Medicare by having worked 40 quarters or 10 years, if you're a U.S. citizen or a resident, a permanent resident that's been here for 5 years before you apply, if you're in your 25th month of disability, you're automatically on Medicare. If you've got Lou Gehrig's disease or kidney failure, that's automatically eligible for Medicare. And all this information will help me in asking you questions about your doctors. I need to know who your providers are. I need to know your medications. And I put all this into a website that spits out all the plans that are applicable for you. But first, we have to make sure that you're registered for Medicare. And the way you get registered for Medicare is going on the Social Security website if you're not already collecting Social Security. If you're collecting Social Security, then you automatically get Medicare card in the mail. If you're not collecting, then you have to register like you would register a credit card. You put in your name, an ID, a password, all the information, and then you go on and answer questions about where you live, your address, your zip code, your phone number, all this contact information and other questions they're going to ask you, and you tell them when you want your Medicare to start. It'll usually start the first of the month of your birthday. Now, if you register 3 months before your birthday, everything will start on your birthday month. If you wait till your birthday month or the 3 months after, it'll start the first of the month after you register. So you want to do this as soon as possible, usually 4 to 6 months in advance to get going on this. Once you're registered, you've got your Medicare card, then we can start looking for plans for you. And we'll sit down and we'll discuss what exactly you're looking for. You could either have a Medicare supplement or a Medicare Advantage. A Medicare supplement covers all your doctors, usually no co-pays at all, but it's not cheap. They can range anywhere from $200 to $300 a month, depending on the level of the supplement. And then you have to buy a separate standalone drug plan. And that could be anywhere from $0 to $100 a month also. Now, the difference with a Medicare Advantage is there is no premium. It's free. What you have to pay are co-pays when you go to the doctor. They can range anywhere. They're usually all $0 for a primary doctor, but then there could be anywhere from $35 to $65, some as low as even $15 or $20 for a specialist, depending on the plan. And they come with a lot of extra benefits. They come with dental, they come with vision, they come with hearing, they even come with over-the-counter. Some plans give you anywhere from $25 to $50 a month to go purchase over-the-counter items. And you can go to the drugstore or you can do it in a catalog. Some of them give you other items like free gym membership, silver sneakers. Also, you can have free medical transportation, a digital tracker, free preventative services. So if you're leaving your job, that's another thing to take into consideration, because if you're leaving your job, you want to make sure that you've had creditable drug coverage with your employer from all the time you've been there, because once you're 65 and you don't have creditable drug coverage, there's a penalty to pay to Medicare for the rest of your life. It's usually 1% a month for all the months that you didn't have creditable coverage. Most employer plans do have it, but you want to confirm that. Then you want to make sure you coordinate. Then when you're leaving your employer plan, you want the Medicare plan to start the day after. Once you leave your employer plan, you want to make sure that your Medicare coverage starts the very next day so that you don't have a gap in coverage, because you never know what can happen. While you're on Medicare, you're going to have all kinds of documents that you're going to have to save. You're going to save your Social Security benefit letter. You're going to save all kinds of documents. If you get something in the mail, you want to open it right away. It might ask you to respond, and you have to do it in a timely manner, because if you don't, you might lose your Medicare coverage. I also help people with Medicaid and with low-income programs. So if somebody is low income and they don't have Medicare, Maybe they came to this country late. Maybe they didn't pay into Social Security. There's ways to get Medicare, and I know how to do that, and I can help them with that. If they need Medicaid, I can help them with applying for Medicaid. And usually Medicaid is based on your assets and your income. So I take all this into consideration. I show you where to go to apply. And if you do have Medicare and Medicaid, we can push you into a dual plan that covers both and gives you extra benefits. Depending on the level of Medicaid, you might have to pay zero for everything, whether you want dentures, whether you have crowns, whether you have to have extractions, hearing aids up to $2,500 per ear per year. There's a lot of wonderful benefits when you're on Medicaid and Medicare. So please contact me if you need help. My name is Linda Gordon, and it's Linda Gordon Insurance Solutions. I can be reached at 646-957-0085 or medicareadvicefla@gmail.com.